It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following: hepatitis in dogs, symptoms and treatment. Hepatitis in dogs can cause some very serious or even life-threatening symptoms for your dog. There are two types of hepatitis commonly seen in dogs: infectious canine hepatitis and chronic canine hepatitis. Canine infectious hepatitis. Infectious canine hepatitis is an acute contagious disease in dogs. The virus attacks the liver, lungs, kidneys, spleen, lining of blood vessels, and occasionally other organs of the infected pet. The signs of infectious canine hepatitis can vary widely, from mild fever to death. Canine chronic hepatitis. Canine chronic hepatitis is a condition that is associated with infectious canine hepatitis. 1. Causes of hepatitis in dogs. Dogs are most often infected with hepatitis by consuming feces, saliva, nasal discharge, or urine from infected dogs. Dogs that recover from the condition will shed the virus in their urine for at least 6 months. In some cases, dogs can develop severe chronic hepatitis as a result of damage caused by copper buildup in liver cells. 2. Symptoms of hepatitis in dogs. Infectious canine hepatitis can cause a variety of signs and symptoms. If your dog is suffering from infectious hepatitis, you may notice one or more of the following symptoms: watery discharge from eyes and nose, congestion, slight fever, deficiency of blood coagulation, blindness, loss of appetite, thirst, enlarged tonsils, yellowish and jaundiced appearance of the ears, gums, and skin, eye inflammation, severe depression, abdominal pain, occasional, vomiting, occasional, red or bruised nose and mouth, spontaneous bleeding. In severe cases, the following symptoms: red dots on the skin, red or bruised nose and mouth, swelling, neck, head, lymph nodes, seizures, death. Although the disease has become rare in areas where routine vaccinations are used, you should still pay attention, as the disease can develop rapidly in both puppies and dogs. 3. Treatment for hepatitis in dogs. Depending on the results of the biopsy, your vet may recommend treating the condition with a broad-spectrum antibiotic, anti-inflammatory, or immunosuppressive medication. Sometimes a painful spasm can be associated with opacity of the cornea in the eye. Your vet can prescribe an eye ointment to ease your pup's pain. If your dog is experiencing corneal clouding, it is essential to protect your pup's eye from bright light. Treatment options can range from intravenous fluid therapy to hospitalization. Your dog will require regular blood tests for monitoring purposes. 4. Prognosis of hepatitis in dogs. After recovery from the disease, immune complex reactions can cause opacity of the cornea of the eye and long-term damage to the kidneys. Although some cases of acute hepatitis can be cured, chronic hepatitis cannot be cured, but will need monitoring and treatment so that your pup can live a long, good quality life with minimal clinical signs. 5. Prevention of hepatitis in dogs. A mandatory vaccination is the most widely used and important preventive measure for infectious canine hepatitis. Your dog will usually receive this vaccine along with his canine distemper vaccinations. The hepatitis vaccine is usually given to puppies between 7 and 9 weeks of age, with the first booster between 11 and 13 weeks, after which they will be protected. To remain protected against this serious condition, your dog will need to continue receiving booster shots throughout his life, with another one at 15 months and then every year to keep the infection at bay. Caution: the advice in this video is for informational purposes and does not constitute medical advice regarding pets. For an accurate diagnosis of your pet's condition, make an appointment with your vet. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.